Hey everybody, Dr. Rob here. It's my pleasure again to be here. Really exciting topic. Everybody sit down, buckle up. We're going to talk about brain. Without question, brain and brain health has come to the top of everybody's consciousness. This month alone, when we look at it, we're speaking about a whole bunch of different things. We've got the Alzheimer's and Brain Awareness Month. So this is from alzheimers.org. It's a lot of really good information. In my office, we're seeing a lot of brain injuries. We're seeing a lot of brain awareness. We're seeing a lot of gut to brain access. So we're going to go a little bit more into that. But I want to share with you 10 ways so you can all have better brain health, or 10 ways, if you will, to love your brain. Let's start with number one. I strongly suggest everybody hit the books. So it's never too late to read a book. It's never too late to add another language. It's never too late to always educate yourself. So if I'm not enrolled in a course, a course where I'm getting a degree or a certification, I'm enrolled in a course for my own edification, my own education. I'm also reading articles every day, and I strongly suggest everybody keep that brain alive. So constantly challenge yourself, constantly keep your brain alive, constantly read, educate, number one. Number two, butt out, as they say. That's increased smoking has shown an increase in cognitive decline. I'll say that again. Increased smoking has shown an increase in cognitive decline. Having said that, if you decrease your smoking over a duration of time, you will have the same health benefits as if you never smoked. I kind of feel cheated because I never smoked a cigarette in my life, but I'm happy for everybody to come join me, no smoking. Now, interesting, as a little aside, for your spinal injuries, those people who smoke have a much higher incidence of spinal injuries and a much slower recovery from a spinal injury. And in addition to that, they've shown people who smoke lose 13.6 years on their life. So smoking is a no bueno. Get rid of it. Follow your heart. What do I mean by that? Cardiovascular disease, obesity, high blood pressure, diabetes. All of these things are things that can damage your heart. So you want to precipitously decrease these incidents. You don't want any cardiovascular issues. And we all know, we've talked about it, 42% of Americans are obese, 75% of Americans are obese and are overweight, only 12% of Americans are metabolically active. So we want to look at all those issues, what I call diseases, what I call the average American disease. So clearly you want to change your diet, you want to change your lifestyle, things of that nature. It's interesting what I mentioned in the cardiovascular, the high blood pressure, the obesity, and diabetes, they damage your brain, but they also sound like the comorbidities for COVID-19. They also sound like the comorbidities for having failing health. Heads up. So Alzheimers.org talks about heads up, and that's brain injury. Now I really want to dig into this. Brain injury decreases your cognitive decline. So what are we talking about? A concussion. Concussion, your brain. Your brain is 3 pounds. It's made of the consistency of Jell-O. Damaging your brain or getting hit, that whip-like motion of your brain moving back and forth, is shearing and tearing brain tissue, tearing axons. If you have a higher incidence of concussion, it leads you to a higher incidence of Alzheimer's. There's something called the blood-brain barrier, and that wraps the bulk of the brain. That tearing of the blood-brain barrier is one of the first signs of Alzheimer's. Now, with that being said, that first sign of Alzheimer's, we can test for the blood-brain barrier. And when that blood-brain barrier opens, you have a higher incidence of specific proteins going in, which are called tau and amyloid proteins. Most of those come from your gut. So let's all remember, they talk about this is Brain Awareness Month. It should also be Brain Awareness Gut Month, or Brain Awareness from the brain to gut bidirectional axis. So you had a question, really good one. Can we bounce back or grow cells back caused by concussion? Absolutely, you can. They call that neurogenesis. And you get neurogenesis because you increase the release of a protein enzyme called brain-derived neurotrophic factors, BDNF. BDNF comes from your gut, goes to the hippocampus, the front part of your brain. The hippocampus is, they nicknamed it in Latin, your seahorse. And the hippocampus then is able to grow back certain cells, axons, and the like. So what I find most interesting about BDNF is what really enables us to increase the release of BDNF. The number one thing, so hear me out, After concussion, the number one recommendation that is made, the literature indicates this, is exercise. So let me be specific about the exercise. It's not necessarily high, intense interval training. It's not a hard swim. It is steady state exercise. And the reason you want steady state exercise is you don't want to move your head too much, because after concussion, the shaking of a head like I'm doing, the bouncing of the head may precipitate you to start to feel the symptomology. So you want steady state exercise. BDNF is a great choice. Low-level laser is also a great choice to grow back those axons. Brain neurogenesis is nerves are able to grow back. As far as we know, it was stated in 2013 in a multitude of articles, and then succeeding going forward, we've seen more articles talk more and more about that. In addition to exercise and low-level lasers, another great choice. The literature is robust on low-level laser, enabling you to create a microenvironment in the brain of decreasing inflammation, and also showed real good signs of releasing BDNF. I have 2 studies on that alone. In addition to those 2 aforementioned ideas, turmeric is also a great choice. Alpha-lipoic acid, ashwagandha, coffee. These are all nutrients that'll do a great job. Omega-3 fatty acids. So there's nutrients, there's lifestyle exercise, there's a modality called laser, all that enables you to grow neurons back. So just because your brain has degenerated, you can then respond. Now, most interesting about that, and we talked about the blood-brain barrier, is the less autoimmunity you have in your body, the better chance you have if you have a blood-brain barrier damage. So autoimmunity means the less antibodies you have that will attack and eat your own tissue, is you'll have a better chance, because what happens is you'll have less damage to those axons and neurons. And what you're also going to see in that is that a blood-brain barrier test is a critical element, and I recommend a lot of blood tests for the blood-brain barrier. How long does it take to mend from brain injury? It really depends on the extent of the brain injury and how long you've had the injury. So I always suggest don't rest it. Go see somebody, get some help. So many times, so many people have had a brain injury, have rested it, and waited too long, and that inflammation in the brain has caused degeneration. The longer you wait, the longer it takes to come back. But please don't fret. If it's 10 days, 10 years, you still can improve your status. So just remember, what you have now doesn't mean that's what you'll have tomorrow. After a concussion, if you have something called the APOE4 gene, and that's a gene that really shows that you have a genetic disposition to Alzheimer's, concussion with that increases your incidence of Alzheimer's by 80%. So I strongly recommend everybody also testing your APOE4 gene. So heads up, brain injury will increase cognitive decline, will also increase your incidence of Alzheimer's prodigiously. Fuel upright, eat healthy and a balanced diet. It's all about how we eat. You've heard me say a multitude of times, bad food stimulates inflammation through signals. Good food potentiates health information. So some of the things that I recommend for people for brain, I'm not a big proponent of carbohydrates if you want your brain to function well. Last I read a while ago, and it seems to have gone away, but it really still is resonating in the literature, is diabetes type 3, they used to call Alzheimer's. Your brain, everybody, functions and fuels better on fat. It's clean fuel. Carbohydrates are dirty fuel. So I'm a strong proponent. That doesn't mean you have to throw all carbohydrates out, but let's all remember, there are no essential carbohydrates. There are essential fatty acids and there are essential amino acids. So when you're not sure what to eat, protein and fat are going to be better choices for carbohydrates. Now, when you look at the diets that I recommend, for anybody who's suffering a neurodegenerative disease, typically I recommend the ketogenic diet. The ketogenic diet's about 70 to 75% fat, 20% protein, and 5% carbohydrates. And I always speak about the idea of what we call the clean versus the dirty keto. So the clean keto is not going to have any gluten, it's not going to have any dairy, and it's not going to have the processed food. So an organic sausage, as opposed to the sausage that you'll get in the meat market, is a major change. Just because it's packaged and it has a high fat content, it's still processed. I want you to eat clean fuel. Clean food and clean fuel are a great choice. So I do like the ketogenic diet, especially for neurodegenerative disease, because it makes ketone bodies. Ketone bodies enable you to fuel the brain appropriately. The Mediterranean diet has a plethora, if you will, of literature really speaking about overall health, and more so than overall health, speaking about brain health. So the takeaway here is whatever diet you consider, you want to do a few things. You want to decrease your sugar. You want to decrease your crappy carbs. You don't want to eat anything that man makes, and you want to up your fats, but eat good quality fats. One little tidbit. LPS, which is an indicator for leaky gut, can be released, can be indicated from if you eat too much coconut oil. So I'm a proponent of MCT oil. As a matter of fact, if someone comes in with a concussion, I recommend MCT oil, but I don't recommend tons and tons of the MCT oil. You want to eat more mono and polyunsaturated. A good monounsaturated fat would be, without question, a good monounsaturated, Creator Chiropractic, there we are. A good monounsaturated fat would be avocados, and I want you to avoid a lot of the liquid fats. So there is no junk food, Creator Chiropractic. There's just food and there is junk, Dr. Rob. Thank you. Good man. Love it. So we're halfway through it. So if you guys have any questions, feel free to share them with me. More so than if you have any questions, make a comment, ask a question. I'm here to help. I'm very excited to share this information because, we've had enough conversation today for COVID-19. And having just brought that up, COVID-19, which does damage the central nervous system, we're also seeing brain damage too. So there's a lot of tie-ins. The body's all interconnected. Just remember, whatever you do to your brain, you're going to do to your gut. Whatever you do to your gut, you do to your brain. If you have trauma to your brain, it increases your incidence of neurodegenerative disease, Alzheimer's being one of them. Alzheimer's is the 6th leading cause of death. Dr. Dale Bredesen made a great comment. He said, everybody knows a cancer survivor. To date, we don't know an Alzheimer's survivor. So catch some Z's, catch some sleep. You want to improve your memory, you want to improve your thinking, get some sleep, without question. I'm having some help, I can't see it, so. Do you want to help me? Great. Great, thanks. 12 carbons in coconut oil closer to long chain. Yes, great question. So it's not a medium chain fatty acid, it's a long chain fatty acid. So the point was very well said. You want medium chain triglycerides, medium chain triglycerides, MCT, that's coconut oil. So you want carbon 8 and carbon 10. They're going to give you an immediate burst of energy. Coconut oil, actually, or lauric acid in coconut oil, is a 12 carbon. It is a great antimicrobial. It's excellent for overall health, but it's a little too slow to feed the brain to give it instant energy. Just so you know, fat can be instant energy. It gets to the brain much quicker than carbohydrates, and carbohydrates can, on the way through the processes, damage some organs. Carbs are sneaky. They're stealthy, if you will. So great question. I really appreciate that, by Dr. Mike Powell and my good friend from Creator Chiropractic. Sleep. Sleep's a critical element. Sleep will help improve memory and thinking. Now, with sleep, what's interesting about it is sleep rejuvenates your immune system. It allows your brain to detox. You shrink 40% of your brain when you sleep, but guess what? It's squeezing out, like sponging out. It's sponging out toxic chemicals and toxic wastes. It's sponging out those amyloids. It's sponging out those tau. So if you have a neurodegenerative disease, a good sleep will work. The best way to detox your waste of your brain can be the position in which you sleep. Sleeping on your left side has shown through multiple studies to be the best way to detox your brain. So if you're, a side sleeper, switch to that left side. So sleep is a critical element. I saw somebody in my house go like that. Take care of your mental health. And that was not a joke. And please, no comments about me, everybody. Depression, anxiety, mental health. Those are things that you really want to address, because that leads you down this slippery slope, this vertiginous slope that may lead you to higher incidence of Alzheimer's. Did you want? Great. Laser and lymphatics. So Crater, I missed that. Sorry about that, Mike. Laser and lymphatics, absolutely. It's so funny. Mike and I were having a conversation. We were talking about somebody with the concept of lymphatics and how the body gets rid of certain cholesterols, triglycerides, and such. Laser therapy, low-level laser therapy. Creator Chiropractic has a bunch of lasers, a cornucopia, if you will, a large number. And with that having been covered, they do a lot of lasers, and we recommend a lot of lasers for lymphatic drainage. Now, the lymphatic system in the brain is the glymphatic system. So to stimulate that will stimulate the release of toxic wastes. Buddy up. And what we mean by that is stay social, meaningful activities. We're being social now. We're talking, yes, social distance, be cautious, but we are going back into the public. We can FaceTime people, social, relying on other people, that friendship. That's what we are. We're humans, so we need that. That's great for brain. Did you ever feel depressed or not? You're just having a bad day. It happens, and you call a friend or you call somebody, or you do something for somebody, and you feel better about yourself. You feel better about your brain. Stump yourself. Really challenge yourself. Do a jigsaw puzzle. Don't do one that you know you can do. Challenge yourself. Do something artistic. I can't draw. Challenge your intellectual capacity, because if you don't use it, you will lose it. And last, break a sweat. Exercise. Exercise is a great choice. You want a cardiovascular, healthy body. Exercise that elevates your heart rate, increases your blood flow to your body and brain. Studies have found an association between physical activity and reduced risk of cognitive decline. We're made to move. Let's get moving. So those are the 10 things. That's Alzheimer's.org. I took it from them. I extemporized and expanded on some of that. Now, let's talk a little bit more about just Alzheimer's in general. Some of the things that are recommended. I want to put it up in a nice tight bow. And a lot of this, once again, with all due respect, is from Dr. Dale Bretson. He does a great job of talking about Alzheimer's. Okay, we just lost our screen. There we go. Not a problem. Little technical difficulties. Some of the nutrients that I recommend would be omega-3 fatty acids, vitamin C, B vitamins, vitamin D, anything with an antioxidant, anything with a polyphenol, organic coffee. Got something coming real soon on that. Not only organic coffee, pro-resolving mediators. They stop or they allow for the resolution of inflammation. So that's a great choice. In addition, you may want to consider turmeric. What's better than turmeric? Everybody knows that. You have curcumin, which is the main ingredient in turmeric. Choline now has been shown to aid in brain development. One of the big takeaways in supplements is magnesium L-threonate. Magnesium L-threonate was studied by the MIT. They published a study in September of 2016 in that it really decreased brain aging by 9 to 14 years. Coupling that with increasing bioavailable magnesium by 50% in the brain to allow for all the enzymatic reactions that it does, and a 15% increase in the cerebral spinal fluid in the spine. So everybody knows that the spine feeds the brain and the spinal cord are the central nervous system. Without a strong functioning central nervous system, you're not going to have good health outcomes and good health functions. Many of those supplements also segue into how to help with a concussion. And I think that I just had a few people DM me and say they'd like to have some concussion work. We're going to talk about concussion this week because concussion is a critical element. And you know what? I will talk about concussion tomorrow. So everybody tune in. We're going to talk about concussion. We're going to do that probably 2 o'clock, between 1:30 and 2 o'clock tomorrow. I'll put a post tomorrow when I get to work to let everybody know what time. So in reference to Alzheimer's, also we talked about those exercises. Those are critical elements. Challenge your brain. So do we have any more questions? Hey, Diane Miller. Watch this. Great information. I really appreciate that. So again, I'm trying to keep them real short and real tight. We're just at about 20 minutes. So again, if you like it, please like it, share it, have a comment. Remember, we're on LinkedIn. It's all Dr. Robert Silverman, YouTube, Instagram, and my Twitter is Rob Silverman. Oh, I got another question on my DM over here. I wish they'd put them up over there. They asked how many visits, if somebody had a neurodegenerative disease, could you respond in? Kind of piggybacking on what May had asked a little earlier. And it's really not about visits. So I have a patient who's coming in for ALS. What you really want to do is you want to do brain treatments. You want to work with the brain. You want to change their lifestyle. You also want to laser their gut. You also want to work with their gut. So everybody knows my new book is coming out, The Superhighway to Health, 7 Steps to Optimizing the Gut-Brain Axis. Within that, you always want to give good gut health. You know, it's so interesting how the gut and the brain communicate. I mean, I can't tell you when the light bulb goes off, and when I tell patients they understand the body and the brain are bidirectional, they're intercommunicating, the gut really communicates with all other organs, and you can't live without a brain. It's your chip. It tells you what to do. So for instance, you'll exercise better if you keep your brain strong. Hold on, we got a good question. We'd love to know, how do you prepare family to deal with Alzheimer's family member? You know, you don't have to deal with it. Do the things that we just talked about. You know what? Also, reach out to me. Give me a call if you're locally. Let me help you. I'm looking over here. I'm sorry. Let me help you by treating you. Let me share my gut and brain protocol with you. Change their diet. We've got a lot of things that we can do to help the symptomology of it. Nobody treats a disease. We help the body, and we treat. We'll look at some of the symptoms to know which systems are being compromised. So the idea of the gut and the brain is interesting. Getting back to the exercise, if you just do front planks, you're actually stimulating pathways to the brain. If you do a front plank and get on a physio ball, you're going to stimulate more pathways to the brain. So you're going to stimulate that spinal cerebellar pathway. If you take your right arm to your left leg, like a bird dog or any kind of cross crawl thing, you're going to stimulate left and right hemispheres. You have to do things that are going to stimulate the brain's communication. You have to do things that are helping the gut. You need to help the gut to communicate with the brain. We're going to talk about concussion tomorrow. You'd like to hear, Trill, you'd like to hear more of the gut protocol. All right, I'm not going. Let's talk gut protocol. No problem. We're on fire. We call it the 7R program. It's Dr. Rob's 7R action steps. Number 1, you want to reset. What do you reset? You reset your lifestyle. You reset your lifestyle through diet. What kind of diet? We talked about a little before. We're a big proponent of no gluten, no dairy, no sugar, no processed food. Eat whole, good foods. Remember, food is your fuel. People spend more money on the fuel they put in their car than they do what they put in their body. And what you eat is fuel. It's not just fuel, it's information. When I say information, it's communicative with your gut and your brain. So if you're eating something healthy, like an avocado, versus a Dorito, imagine what your gut and brain are going to say. So if you want to perform, if you want to have energy, clearly you want to eat better food. So the keto, the Mediterranean diet, diets of that note are excellent choices, but it should always be individualized for you. I do a lot of genetic tests. Everybody knows I work with Toolbox My Origin, and in those genetic tests, we determine your propensity towards TBI and concussion. We're always checking for the APOE4, which we talked about before. And also, we're also looking through the nutrient optimization kit. In that nutrient optimization kit, we're also looking to see what kind of foods you can absorb. Whether, like for me, I have a little trouble with saturated fats, etc. I'm only on the first star trail. If you laser the gut, you go for the vagus protocol. If I laser the gut, I always do the vagus nerve. I'll come back to those 6 R's. If I laser the gut, I'm doing the vagus nerve, medulla oblongata, down through the transverse colon, and then I put the red light on the gut. Incidentally, you obviously are a Aconia laser owner. Reach out to me, Trill, because now we've got an FX405, which has both the red and the violet lights together. The second R is remove. We want to remove all the bad bacteria. Remove all the bad bacteria by what? Having a detoxification, using specific oreganos, berberine, and garlic. 3, you're going to not re-inoculate, you're going to replace. You're going to replace stomach acids, pancreatic acids, and bile. 4, this is just a gloss over. 4, you're going to rejuvenate, you're going to repair, you're going to heal and seal the gut lining. So whatever leaky gut permeability you have, you're going to patch that all up. 5, you're going to reinoculate with good quality probiotics. I should get my buddy Dr. Bugs on, and that's what we call him because he's all about the bugs, and we should talk about what a good probiotic and what something else you may want to pass on in the future. But good quality probiotics, a multitude of choices out there. I like some specific ones. If anybody's interested, please feel free to reach out. The 6th one is you want to retest and reintroduce. Whatever test you did at the beginning, whether it's a symptom test or a blood test, you want to do again. Within that test, you also want to reintroduce. So what we took away in the removal, which I forgot to mention, is foods. You may want to put certain foods in. Breaks, no gluten, no dairy, but I'm talking about maybe spirulina you show the food sensitivity to. But once you fix your gut lining, you're not sensitive to spirulina. We do a lot of food sensitivities. Anybody interested? Feel free to reach out. And last, you retain. Do what? You retain your health. How do you retain your health? Good diet, exercise, and 5 supplements I typically recommend. A multivitamin, multimineral, omega-3 fatty acids, D3 5000 with K2 generically, a probiotic, and a good fruits and greens drink. So we got a lot of followers. We got a lot of people. Anybody else have questions before we look to sign off? Because everybody always pops in after, and I want to be able to end them. Don't forget, tomorrow is concussion. All right, well, great. It's been my pleasure. I'm happy so many people chimed in. Everybody, please feel free to come in. We're going to be on about 1:30 tomorrow. I'm happy we're talking about the brain. We're going to do some brain stuff. My name is Dr. Rob Silverman, Amazon best-selling author of Inside Out Health. Dr. Rob, always yours in health. See you tomorrow.